Hi, I'm Serina Taylor. I am a disease investigator with the Johnson County Department of Health and Environment. I'm also one of the co-chairs for the Health Equity Council. And today I'm going to talk about why COVID-19 disproportionately affects people of color, and specifically people of color in Johnson County. We look at places that people live, work, learn, play, anything that could potentially affect any of their health outcomes or potentially cause them to become sicker. When we're talking about COVID-19, public health looks a lot at the social determinants of health, like neighborhood and physical environment, your occupation, your health and health care and access to that, also your income and education as well. So when we look at neighborhood and physical environment, we're looking at how many people are going to be living in your household, because we know it's common for some cultures to have many generations in a household. That can cause diseases to spread pretty quickly. If there's a lot of closely knit communities, that can also cause people to spread disease quickly because they don't have the ability to maybe self-quarantine or even self-isolate. For your occupation, if you are a little bit more of those front-facing jobs like grocery store workers, factories, or anywhere else that maybe you have close contact with people or even close contact with the public, you're more likely to become infected with other diseases, but especially COVID-19. When we talk about access to health and healthcare, we're talking like, do you have insurance? Do you have the ability to go to a hospital and even pay for the hospital bills that may come if you have severe illnesses? And the last one that we focus on is also education, which could lead to whether or not you have the ability to have jobs that maybe allow you to work from home, or if you're relying on multiple jobs as well. So that's something that we also look into. This is important because it's happening here. So if you were to look at our dashboard, towards the end of March, we saw that we had 1.7 times as many COVID cases in Hispanics than we did white non-Hispanics, and 1.4 times as many COVID cases in Black non-Hispanics as we did than white non-Hispanics. And our hospitalization trends for COVID-19 is also very similar. And your deaths, that's a similar trend as well. We saw that if our Black non-Hispanic population was about 1.2 times as many deaths than the non-white Hispanic COVID deaths. And what we can do to help with that is we can make sure that the resources that we have can get to those individuals who need it the most. So it helps having testing sites more readily available, but if they're uninsured, they may not go get tested. When you are out in the community, make sure you're wearing a mask, because you never know who you could be coming in contact with if they are in a situation where maybe they aren't able to self-isolate or quarantine because of maybe the household situation that they live in. So, just continue social distancing when possible, vaccinate when you can, and of course, stay home when you're sick.